Say hi.
Hi.
Okay. All right, so we're going to do the full shoulder exam. First thing we're going to do is take our history, and I'm just going to have you, instead of specializing it for the shoulder, just do your general history, which is your 6 questions. So you're going to find out as much information as you can about the structures involved, the severity of the injury, etc. So you're going to ask the mechanism of injury, right? So mechanism of injury, or how it occurred, when it occurred, whether it was chronic or acute, if they've had any previous injuries before, if they heard any unusual sounds, felt any unusual sensations, and what's their chief complaint at the moment. And then we're going to go on to our visual inspection, looking bilaterally for her posture, in this case for her shoulder, for her knee it would be her gait. So we're looking at her posture to see if there's any changes. If she was holding her arm down, that would be brachial plexus injury. If she was cradling her arm, that would be a clavicle fracture. So along with her posture, we look bilaterally for swelling, deformity, bleeding, discoloration, and scars and abrasions. And then we're going to move on to our palpation. And I'm going to stand behind for the palpation. We're going to palpate for pain and point tenderness, swelling, deformity, discoloration, or swelling, deformity, crepitus. I guess that's it. So now we're going to start at the SC joint. Let's see if there's any problems there. We're going to move all along the clavicle, all the way out to the AC joint. I'm going to palpate the head of the humerus, the bicipital groove. Feel the long head of the biceps in there. We're going to palpate all along the scapula on the back side. We can bring the shoulder back and bring the subacromial bursa forward and palpate there. Palpate on top for the supraspinatus tendon. And again, we did the long head of the biceps. Palpate the deltoid and then the trapezius muscles. Then we're going to do our assessment. We're going to do our ligamentous assessment. We can do our glide test to check for laxity at the AC and SC joints, or piano key sign. So glide test, we're just grabbing the clavicle and moving it back and forth. Or piano key sign, which is just to move at either joint, push down on the clavicle and see if there's any excessive movement. We're going to do the anterior apprehension test, which checks for anterior inferior shoulder dislocation. So I'm going to bring the arm up in abduction, 90 degrees, 90 degrees of elbow flexion, and then I'm not going to bring it back, but I'm going to externally rotate back. I'm going to make sure that I put my hand right on front of the glenohumeral joint in case the head of the humerus slides out. And then the last one is the glenohumeral load and shift, looking again for laxity. I'm going to grab the head of the humerus and I'm going to glide it posteriorly. I'm looking to see how much the head of the humerus displaces out of the glenoid fossa. I'm going to move on to our special test, checking for rotator cuff. I'm going to do the empty can test. So I'm going to have you bring your arms out to the side. This is at an angle, thumbs down. I'm going to have her resisting as I push her down. I'm going to have her do the drop arm test. She's going to bring her arms up all the way overhead and then slowly bring them down. If she had a torn rotator cuff muscle, the arm would fall down about 90 degrees. I'm going to do the impingement test. First one is Kennedy-Hawkins. You're going to internally rotate and then bring your arm up. And I'm going to apply some overpressure. And the crossover impingement test is I'm going to bend her elbow and then I'm going to internally rotate the arm. Trying to impinge, see if those structures impinge the long head of the biceps, the supraspinatus, and the subacromial bursa impinge under the acromion, between the acromion and the head of the humerus. I'm going to take out for you guys the posterior apprehension test, and then we'll continue on with the sulcus sign. The sulcus sign again checks for laxity. So I'm going to put my thumb right on the end of the acromion process, and I'm going to pull down, and I'm going to do this again bilaterally, seeing how much space opens up between, and you can see the space right there between the acromion process and the head of the humerus, and we pull here bilaterally. You're going Goodsen's test and speed test checks for long-headed biceps. Jurgensen's checks for subluxation. I'm going to have her put her elbow at 90, hold it into the side, and she's going to resist me as I pull her arm down and out. And a positive test would be the long-headed biceps subluxing out of the groove if that little ligament was torn. Speed test checks for irritations of the long-headed biceps, and this is just shoulder flexion against resistance. So go ahead and flex your arm up, and I'm going to provide resistance to see if that causes pain. And I'm going to have you guys skip the relocation test for anterior instability. Then we're going to move on to neurological tests. We're going to do Adson's tests. These two tests, the Adson's and Allen's checks for thoracic outlet syndrome. So I'm going to palpate her pulse. And then I'm going to abduct her arm, externally rotate it, or extend it and externally rotate it. She's going to turn towards me and hold her breath. And I'm going to see if her pulse diminishes. And that checks for scalene tightness. To check for pec minor tightness, I'm going to abduct her arm and externally rotate it and have her turn her head away as I'm checking her pulse and hold her breath. And again, I'm just seeing if the pulse diminishes, if there's any thoracic outlet syndrome. And then I'm going to check her motor, sensory, and reflexes. So sensory, C5 through T1. We have C5, C6, C7, C8, and T1. So that's C5, C6 to here, C7, C8, and T1. To check her motor, we're going to have her do C5, resist C5, and then C6 is biceps flexion, C7 is triceps extension, and C8 and T1 is finger abduction. So I'd have her, don't let me push your fingers in, don't let me push your fingers in, and then put your fingers together, and don't let me pull your fingers apart. And the last one is for reflexes. For C5, it's the bicep reflex. I'm going to use the pointy end of the hammer. I'm going to put my thumb on the medial aspect right over her tendon, her biceps tendon, relax, and relax. And then with my thumb on, I'm going to hit my thumb, and I'm going to feel for just a tiny little under my thumb, I feel the tendon shorten. So you may not see a big movement, but you'll feel the tendon shorten under your finger. And then C6 is brachioradialis, so just above the wrist. And you're going to look for a radial deviation with that. And C7, you're going to bring the arm back, and with the pointy end of the hammer right in the fossa, you're going to go right there and just looking for that little extension movement of the arm. And that's